Okay, thanks everyone for joining us. So we are very pleased to welcome Dr. James Nobles. So James is a senior research fellow at Leeds Beckett University, part of the Obesity Institute. James specializes in pragmatic mixed methods research for obesity prevention and treatment. His core interests lie in the design, implementation, and evaluation of systems approaches to help address non-communicable diseases. James's early research examined family engagement with weight management services in the UK, and later involved a strong collaboration with Shine Health Academy for young people with severe obesity. Currently, James's research focuses on preventing non-communicable diseases, particularly obesity, through systems approaches. He has led large-scale evaluations, developed innovative methods, and co-led the creation of a specialist international evaluation network. James is a leading researcher in methods using ripple effects mapping to understand and evaluate complex systems approaches and the action scales model to identify key points for action within complex adaptive systems. So James, I hand over to you. We're very pleased to have you today.
Thanks, Daniel. Really appreciate that warm welcome too. Okay, so what I'm going to talk about today is twofold, really. It's going to be one half is about a tool called the action scales model. And I know from just having a look at some of the previous sessions that you've had, like you've kind of had some sessions about systems mapping and causal loop diagrams. And the action scales model is very much a tool that should be able to support and work alongside methods such as, say, developing causal loop diagrams. And then the other half of this talk is going to be about ripple effects mapping, which is more aligned with trying to capture the wider anticipated or unanticipated impacts of, say, systems change efforts or interventions within complex systems as well. So I'm going to start off by, I guess, just talking a little bit about the calls for systems approaches. Then I'll talk about the action scales model, and then I'll finish by speaking to ripple effects mapping. And then we'll have time at the end as well for some broader discussion around all of this. Daniel did like a really nice job of just talking through some of, I guess, my background, but I just wanted to really double down on a couple of bits, which I think sets the tone for this talk today and gives you a bit more insight as to maybe how I've ended up doing a lot of the research that I have. So I very much see myself as an applied public health researcher. So I work very closely, predominantly with local governments, done a little bit of work at the national government level with sort of the Department for Health and Social Care. But all of what I do is trying to work with these stakeholders, I guess, through a collaborative and often co-productive process. Daniel's already spoken about the interest in the design, the implementation, the evaluation of these approaches. But as I say, it's really for me about how can we translate what it is that we're doing, what it is that we're interested in, so that it fits neatly in a policy and practice context. And both of the methods and the tools that I'm going to talk to you about today are really, I guess, they've been designed in a way in which work nicely for those in the policy and practice context. So starting off on the calls for systems or systems-based approaches. You'll have all seen, well, I'm assuming you may have all seen this, which is the Foresight Obesity Systems Map. And this, for me, really does a nice job of, I guess, setting the scene for the rest of this talk. It includes over 100 different factors, all of which are seen to be, I guess, having an influence upon the population levels of overweight and obesity. But when this was published back in 2007, it's really been, I guess, a landmark report in helping to frame an issue like overweight and obesity at the population level as a really complex problem, and one that's nested in or is an outcome of a complex adaptive system. On the back of, I guess, that report and other work that's been done since, we're now seeing like a lot of advocacy for the use of systems-based approaches. And when I'm speaking about this, I'm speaking about systems-based approaches from like kind of an implementation perspective, not necessarily just about the use of systems-orientated methods. So we've seen advocacy in the fields of obesity prevention, which is predominantly where I've been working. We've seen a lot in fields around physical activity. There's lots of other fields too, but these are just the ones where I've done a good bit of work, those two. And then finally, more broadly, I guess in public health reform, public health practice and policy making. And so that last one is a really nice example of how the Scottish government are, I guess, thinking about how they do public health policy making through the lens of a whole systems approach. So I was involved in the development of some guidance for Public Health England, which was published back in 2019. And this was co-designed with 11 local authorities. And it was to provide them with that support as to how they can design and implement, we refer to it here as a whole systems approach to trying to address overweight and obesity in their local populations. Within this, it draws upon a lot of sort of system science. Systems thinking is really evident all the way throughout it. But the way in which we had to pitch this and frame it was so that it could be taken up and adopted by lots of local authorities, or those who are working in local public health policy. And it included 6 different phases, which I guess helps people go from the very, very beginning in terms of just understanding what a systems approach might be, through to then kind of working through these 6 phases, which goes from getting, and I'll talk through a few of these in a little bit more depth, but it goes from phase 1, which is about getting like the sort of senior leadership support to act in a way in which might align with a whole systems approach, building up that kind of collective understanding as to like what the problem is and the scale of the problem, through to the 3rd phase, which draws upon group model building techniques. So you're bringing together lots of different stakeholders there to develop a comprehensive map of the system that's seen to be driving obesity at the local level, through to sort of phase 4, which is more about action planning. And that's where the action scales model, which I'll talk to in a few moments' time, really aligns quite nicely with. And then it's about kind of corralling and keeping the enthusiasm of a multi-sectoral group of stakeholders to, I guess, implement this approach as it goes forward, and to always kind of be coming back together to reflect on what it is that they're doing, maybe to draw upon some of the evaluation data so that they can then keep feeding that into what that approach looks like over time. I've spoken through, I guess that guidance there is probably like 40 or 50 pages long, and I've maybe spoken that through within a minute or 2 minutes maximum. But it is very much designed so that it can be used by local government or wider partners that they are working with. So when I'm talking about a systems approach, for us, as I said before, like from my point of view, like the systems approach is much more focused on like the implementation or seen as a way of working. So within this guidance, we defined a systems approach as a framework that helps stakeholders to come together to develop that sort of shared understanding around like the complexity, if you like, of a problem or a challenge. For us, that was around overweight and obesity, but this type of guidance too can work for a range of other sort of complex societal issues too. So in bringing those stakeholders together, you get this shared and collective understanding of sort of how that system is operating that's driving the problem to be as it is. And then to get that group of stakeholders to identify where it might be feasible to intervene and to move away from just trying to react to lots of the problems that we see around us, to thinking more systemically about the problem and where they could work, I guess, further upstream to try and prevent these problems from arising further down the line. And it's about collective agreement on actions. I guess there's elements in there too around governance and accountability, and then deciding as a network how they can move forward in order to bring about change. So most of what's on there is kind of cast through the lens of like implementation, whilst acknowledging that we need this sort of shared understanding of like what the problem is and the complexity of that problem. So I'm going to move into speaking now a little bit more about the action scales model. And the reason that I wanted to talk through that PHE guidance is just so that you, I guess, understand where this model in particular fits within that broader context. So as I said before, the 4th phase is all about trying to, just give me one, I'm just going to move because I can see everybody's faces. I'm going to put you all at the bottom. There we go. So the fourth phase is all about, I guess, action and action planning and bringing those stakeholders together to try and identify where within that sort of complexity of the problem they could intervene. And one of the tools that we use and promote within this phase is the action scales model. So it's formed on the premise of leverage points and the ability to identify these leverage points within the complex systems that we are interested in. So if the term around leverage points is a new one for people, these are very much seen as like the modifiable parts of the system that, when altered, lead to changes in how that system behaves. So it's moving away from just reacting to those problems that we're seeing, and it's more interested with how the system is structured and trying to change how that system behaves when we intervene within it. There's often like another kind of aspect to this definition, which I've taken out, which was about trying to identify like sort of where one small change could cause like really big changes elsewhere in the system. And actually, I think from, I guess, the work that we've been involved in, we're trying to like identify like lots of different places to intervene or lots of different leverage points to intervene, rather than just trying to identify one place in particular, which I guess from my point of view, maybe talks a little bit more to that sort of like silver bullet kind of syndrome and trying to identify singular interventions. A lot of the systems working that we're involved in when working with local government is about trying to identify like kind of collective action and intervening across multiple parts of the system simultaneously. But just in terms of a history to this, Donella Meadows has really been sort of at the fore of all of this, and she published like a really nice book called Thinking in Systems. And one of the chapters within that identifies 12 places or 12 leverage points where we could intervene within a complex adaptive system. If you've not read that, or you've not read that chapter, I'd really strongly recommend going and having a look at that. But a lot of the work then around leverage points has sort of fallen out of the back of these 12 places to intervene within a system. So you can see on the left-hand side of the screen here, they're the 12 points to intervene that Donella Meadows identified. And if you go down to the bottom where you've got constants, parameters, and numbers, they're seen to have like the smallest degree of leverage for changing how a system works. And then the further up this ladder you go, the greater the degree of leverage that they're seen to have for systems change. And these 12 points to intervene, I guess they've been tested and used in a public health context, but they've also been adapted and refined slightly too. So some work that colleagues over in Australia have done quite recently, they've translated those sort of 12 points to intervene, and they've put them in public health speak. And so they've got a nice paper there, which is which you can see on the screen. But then other work that Diane Finegood from Canada has been involved in has actually tried to sort of simplify those 12 points to intervene down into, say, a tool that may be perceived to be more useful or usable. And similarly, the work that we have done, like in developing the action scales model, very much aligns back to Donella Meadows' 12 places to intervene. So when we were developing the guidance for Public Health England, and as I say, we were working with those 11 local authorities, we were trying to test out these different tools for identifying leverage points within systems. We immediately knew that Meadows' 12 places to intervene wasn't going to work. It was too academic. And so what we did instead is we used the intervention level framework, which is from Diane Finegood, and we also used the iceberg model of Peter Senge to try and help local authority stakeholders to identify those different places that they could intervene in their local systems. But the feedback that we got from that was that a lot of the terminology that was used in those tools and those models was overly academic, and it wasn't really resonating that well with them when they were working in sort of local public health or local government more broadly. And so we then worked with a collection of local government stakeholders to develop the action scales model. The main thing that I wanted to point out just on this slide is that the action scales model, as I say, is grounded in the initial work that was done by Donella Meadows, and it draws upon each of those 12 points to intervene can be seen then in the different levels of the action scales model. We depicted this quite simply as sort of a set of weights. So on the left-hand side, you've got maybe what the structure and the design of the current system and how that is leading to the outcomes that it's producing. And then on the right-hand side, you've got this sort of desired system. And what the action scales model is, I guess, conceptually asking people to do is to think about what can we do at those 4 different levels, the events, structures, goals, beliefs, to recalibrate these scales so that it starts producing a different set of outcomes that might be more desirable to a certain set of stakeholders. So it's about tipping the scales in a way in which is changing how a certain system is working. And we identified sort of these 4 different levels. And some of this does align with quite nicely with the iceberg model. So what we know is that the vast majority of work historically that had been done was often working at like sort of the events level. So reacting to the problems that we see in our day-to-day lives, but really these are just sort of symptoms of how that broader system is functioning. But we know that there are other things that are driving those problems to occur. So beneath this, we've got the structures, which are, I guess, the ways in which our systems have been set up. So the way in which they're organized, and this might be the different elements within the system, the relationships between them, the flows of information between those different parts. It includes things such as feedback loops, etc., etc. But those structures are set up in a way in which they're set up to try and help work towards certain goals. So from a local government perspective, the systems might be set up in a way in which is trying to help a local authority improve its economic output. It might not necessarily be set up in a way in which is trying to promote the health of its population. So these goals that the system is set up to work towards are really important to try and understand. But ultimately, below all of that, you've got the beliefs or the attitudes or the values of those kind of key individuals or key organizations that are shaping the goals, which shape the structures, which ultimately lead to events. So those beliefs are what are seen to sit at the bottom of the iceberg model. They sit at the top, because it's the other way around in Danella Meadows, 12 places to intervene. She refers to them as sort of the paradigms, but they are the kind of key building block, if you like, as to what's setting these systems up in the way in which they are. So it's those that I guess we need to be trying to consider, as well as the structures and the goals within the system, in order to hopefully change how these systems work over time. So there are certain things that we can do at each of these levels in order to try and bring about, I guess, change within the system. So at that events level, these typically tend to be quite like reactive actions, so sort of those quick fix solutions. And we definitely need to be doing things and working at that level. If we're seeing fires, for example, like arising, like forest fires, they need to be extinguished. Like if we're seeing, I don't know, the high levels of childhood overweight and obesity, we need to make sure that there are support systems in place for those young people living with overweight and obesity. So we have to be able to react to those events, but we need to be able to do more than that too. So we need to work at those other levels as well. So at the structural level, here we can think about like reshaping or redesigning the organization, the relationships, the rules of the system. At the goals level, it's about how can we reorientate those goals so that we're maybe like trying to set the system up in a way in which is producing more conducive health-related or population health-related outcomes. And then what can be done to try and actively change the mindsets of those people and organizations who are setting those goals in the first place. And so there we might start to be seeing things such as like advocacy, lobbying, et cetera, trying to change those beliefs of those people who we think are influential within the system. So just to kind of give you, I suppose, a nice example of this in the context of single-use plastics. Initially, like when I guess we recognized there was a problem around single-use plastics, and one of those might have been about the use of carrier bags within supermarkets. We were initially asked to bring our own carrier bags into the supermarkets in order to reduce our use of those ones that are given away or were given away free of charge at the checkout. So that was seen to sort of be working at the event level within the action scales model. Initially, that was around about all that was done. But over time, we started to see like lots of lobbying, lots of advocacy, trying to, I guess, raise the problem around single-use plastics in a way in which it was able to restructure sort of those goals in the system, so that we start setting specific goals about trying to remove single-use plastics from within our system. On the back of that, we then start seeing some structures or some policies being introduced. So surcharges on plastic bags, policies around not being able to use, say, plastic straws, etc. These sorts of structural changes being introduced. Because of this and other sort of interventions and actions that have been adopted, there's now been an 80% reduction in the usage of plastic bags, say, coming from supermarket checkouts. And this then in turn reinforces the social norms about using or purchasing plastic carrier bags from within supermarkets in order to take your food home. So we've seen kind of a recalibration of the system around single-use plastics. So beforehand, it was very, very common, widespread to use single-use plastics, and the system was set up in a way in which basically enabled that to happen. And we've moved now to a slightly different system around, say, for example, around single-use plastics. Not saying that we're whole scale there yet, but like we have got lots of efforts which are pushing in the same direction. So the action scales model, like part and parcel of that, is about trying to develop a set of actions that are coherent, and they I guess challenge multiple stakeholders to think, how can we reinforce the efforts that we're all putting in to hopefully increase the likelihood of changing systems. And we've got lots and lots of examples of where we're seeing actions and interventions that aren't done in a coherent manner. So some of these examples are probably from within the UK, but we hear a lot of rhetoric about trying to increase active travel. This is probably from, I think we have seen some much more positive changes in more recent years, but going back sort of 5 or 10 years or so, we were hearing that we were wanting to be increasing the amount of people who were using, say, cycling as a mode of transport. But when sort of the beliefs of the system and the goals within the system aren't truly set up to support that, we then start seeing things such as this. So very unsafe, or simply like just, useless cycle lanes being put in place. So there we can see like a real lack of coherence within the system, which is maybe trying to change active transport. So there are several ways in which we can use, say, tools like the action scales model. We can use it to sort of question the assumptions made about a system. If you've developed a systems map, you can use it to almost ask some follow-up questions or ask questions of the system that you've created to say, are we truly representing the problem or the structures within the system? Like, is everything kind of represented within there? Have we got a comprehensive understanding of what it is that's driving the problem? Are we considering the goals that the system is working towards? Are we considering the sort of the beliefs, the attitudes, the mindsets of those people who are structuring the system in the way in which they are? You can then use it to identify places to intervene within the system. And then lastly, and I think probably most importantly, to develop a coherent set of actions that as a collective, they aim to change how that system works. So they're just some of the ways in which we can be using the action scales model. Moving into the second bit that I wanted to talk to, which was about a method that we identified probably like 4 or 5 years ago now, and we've started using it quite widely in a lot of our evaluations, which is ripple effects mapping. But I'm just going to kind of start off with a bit of I guess, a scenario as to why ripple effects mapping might be a useful sort of method to take within some of our public health evaluation. So drawing on a really simple example, there might be some cycling proficiency training that's funded by a local government, and that cycle training is delivered to sort of 10 people, and then 12 weeks later, as part of like a more of a standard impact evaluation, we might gather some data, the same data that we gathered at baseline, to see whether or not those people who attended the training were confident in cycling on their roads. We see loads of these kind of evaluations, and it's really important to be kind of capturing this type of information to say in this context about how confident people feel cycling on those roads. But there might be lots of other things happening because of those people attending, say, this training that those more traditional methods don't necessarily allow us to capture. So of those 10 people who signed up to that cycling proficiency training, there might be several of those people, they might notice that their local roads weren't safe for cyclists. They might go away and start speaking with like local councillors about these issues, and that councillor might then take this up with the council to say, look, we really need to start thinking about improving the quality of our local roads. There might also have been a few people who were really sort of enthused and motivated by that cycle proficiency training. So they go away and they set up a local cycling group. And that cycling group might say meet every couple of or a couple of times a week, and they might have sort of lots of regular attendees. Now, alongside capturing that sort of information that's at the top of this scenario about people's confidence in cycling on roads, I'd also argue that it's equally as important that we try and capture these sort of wider anticipated or unanticipated impacts of these kind of interventions. But there aren't necessarily methods readily available to allow us to do that. And so this is where ripple effects mapping can be potentially a very useful tool to have up your sleeves. And so this is the kind, and it also gives you a feel for the kind of information that you can collect through ripple effects mapping. So what is ripple effects mapping? It's a method that originated from community development work back in 2015 in America. And it's a way of understanding, and I've mentioned these words a few times now, it's a way of understanding like the wider, both the intended and the unintended impacts of a project or a program over time. It takes a participatory approach, and I'll give you, I'll kind of walk this through a little bit more in a few moments' time, but it brings people together who've either been involved in or affected by the delivery of a program, a policy change, or an initiative. And it brings all of those people together to kind of put down on paper or to be captured what they have perceived the impacts of that initiative to be. So it's a qualitative form of impact evaluation. And it's moving slightly away from trying to, I guess, attribute change directly to an intervention. It's more interested in understanding whether or not an action or an intervention might have contributed to changes occurring. It recognizes that there's lots of other things happening within the environments and the systems in which people are living, and that those wider factors or those wider contextual factors will also be having implications on, say, the effectiveness of a given intervention or a program over time. So it's more interested in understanding like how have certain things contributed to change occurring rather than whether or not it's actually directly attributable to a given intervention. If anyone's like interested in having more of a read about this, then I'd really recommend you go and have a look at the field guide by Scott Chasden and Mary Emery. Within that, they sort of describe multiple different methods of doing, multiple different variations of ripple effects mapping. But we really kind of homed in on one of these methods in particular, which was called the in-depth rippling technique. And we wrote about this and we adapted it within a paper that we published back in 2022. And since then, we've seen sort of this adapted method being applied in a range of different scenarios. So it's been applied to try and help understand whole systems approaches in the physical activity, in the integration of physical activity and mental health services, in the evaluation of sort of these really big, what are referred to as local delivery pilots, which are funded by Sport England. So they're place-based systems approaches that are trying to increase the levels of physical activity amongst local communities. It's been used in a sexual and reproductive health sort of intervention setting, workplace health intervention setting, obesity prevention settings, and then more recently in sort of science, arts, and community engagement settings. So it's starting to be used, as I say, in a variety of different settings and different contexts. As I said before, this is a participatory method, and it takes the form primarily of workshops. These workshops typically last between an hour to 2.5 hours long each. And as I say, it invites people who've been involved in or affected by a project or a program. And you can bring a lot less than 20 to 30 people together. You can run these workshops with sort of 4 or 5 people, right through to sort of 20 or 30 people. But if you are working with those bigger groups, then you're still asking them to work in, say, more subgroups of, I don't know, 6 to 8 people maximum to ensure everybody has the opportunity to speak. And what it does is it visually maps out all of the activities or the actions that has occurred within an intervention. And it also maps out the impacts of those activities. And it does that along a timeline. Similar to running focus groups, it requires active facilitation. So if you've got bigger groups of, say, 20 to 30 people, then you probably need to be having at least one facilitator on each of those, or working with each of those smaller subgroups. And what you can also do is run these ripple effect mapping sessions on a regular basis over time. So we're kind of promoting that REM is used concurrently to the implementation of a project, a program, or a change-related effort. So that you can get not necessarily real-time information, but as close to real-time information as possible. And it also, in running it concurrent to the intervention or the activity, it also prevents REM from being overly focused on those positive impacts. It also, I guess, promotes us collecting information about like what's also not working very well or has not led to the impact that we anticipated we might be seeing. And so, again, it's in this sort of in-person format, and the in-person format, I think, is the one which works best. You start getting outputs that look a little bit like those on the right-hand side. So they are quite messy when they're generated within the workshops, but then we can also digitize these and make them look much more accessible to a wider audience. But that's sort of what within the sessions these kind of outputs are looking like. And as you can see in those 2 examples on the right hand side, you've got the timeline across the middle. Within this workshop in particular, at the top of the line is the anticipated impacts, and below the line are some of the unanticipated impacts of that initiative. Not everybody does it that way, but that's just one of the ways in which locally it was adapted for a particular project. Alternatively, you might want to use like sort of 4 or 5 meters of butcher chart paper if you've got lots of people who are working around this. So there's different ways in which you can run it within the actual in-person workshop. But it's all about trying to stimulate discussion between the people who are participating in these sessions. It can be run online using sort of tools like Miro. We've done it using Vensim and facilitated conversations using Vensim as the means of capturing the data. That worked really well. Miro enables lots of people to contribute simultaneously at the same time. And then a little bit more recently, we've started seeing people trying to do hybrid versions where they've got a few people online and a few people in person. I wasn't present in this one, so I'm not sure as to how it worked, but people are certainly testing out the different ways of using this method. I don't have time today to kind of go through the sort of the ins and outs of how to use ripple effects mapping, but within that paper, there's like a really nice overview, like right from the planning the workshops through to the analysis of the data. It's all included within that paper. We've also generated a few, I guess, training videos, which if, I don't know, one of you guys was to use ripple effects mapping, you could then share these training videos with other members of your team who might be facilitating the sessions. In total, like all of this content is only 45 minutes, so it's quite quick to go through, but it just gives people a nice sense and understanding of REM, how to collect the data, and then that final session is on how to analyze the data that comes from it too. And if you're real keen, you can have a look at that sort of field guide as well, which provides information about the other variations of ripple effects mapping and some of the ways in which it has been used. So just to kind of walk through a finalized example before drawing this to a finish, I started using ripple effects mapping initially when trying to evaluate a community building initiative in Gloucester, like Gloucester City. And this community building initiative started by bringing together 65 different organizations who were involved in, they were interested in trying to improve the local environment so that it was more supportive of health and well-being of their population. And one of the things that was identified on the back of this multi-stakeholder event was that actually women in particular in the local community may benefit most from some more targeted intervention. On the back of that, a result was that a couple of workshops were delivered in conjunction with University College London, where they explored some of the barriers and the facilitators to changing the environments around people so that they could maybe be more promotive of physical activity. Now, through those workshops, there was a really kind of enthusiastic set of local community members who actually went away and set up a steering group that basically met thereafter for at least the few years that we were evaluating this. And on the back of that steering group being set up, there was loads and loads and loads of sort of activities and impacts that occurred. Another sort of issue that was identified within one of those barriers and facilitators workshops was that in the local leisure facilities, there weren't any female lifeguards present. And this was a real big barrier for Muslim women in particular using those leisure services. And so members of that steering group went and they met with that leisure provider to discuss and identify possible solutions. And then the leisure provider actually began offering female-only sessions with a female lifeguard to try and, I guess, increase the accessibility of the services to a wider audience. That gives you a sense of like the kind of information that can be captured within these outputs. But as I say, this community building initiative was, there was much more happening than that. So within the first REM session that we ran, we captured this level of information here. And that which is highlighted is just the information that I showed you on the slide before. And we ran 5 of these ripple effect mapping sessions over the course of an 18-month period. And each time we did this, we kind of asked the stakeholders who were involved in the REM to go back and reflect on the extent to which what they had mapped previously had continued to, I guess the ripples had continued or not thereafter. So some things would have continued, other things wouldn't necessarily have continued. And we could ask some quite detailed questions about that. So when we ran the next workshop, we kind of added a bit more information to this output. The workshop after that, more again, until it built up to something that looked a little bit like this, which was the final output. And this output in and of itself told us an awful lot about the community building work that was going on in Gloucester City that was sort of supported by the organisation who had commissioned us for this evaluation. But what we did then in order to make sense of this is we identify something called impact pathways. So just going back to this really simple example, there's sort of 2 of these. And these pathways are really helpful to try and better understand and analyze the data that's held within these REM outputs. So just going back to the example that I showed you previously, we identified like 19 of the 19 impact pathways within the REM output that we created. And then what we're able to do is systematically go through this almost from left to right and code, as you would do sort of interview data, to code the information within these REM outputs so that you can both generate themes and you can also maybe do a content analysis to understand how frequently certain things were occurring within the REM output. And so from kind of outputs like this, we can learn this sort of information. So we're able to understand who's been involved in collaboration between sort of key partners. We can see examples of how mindsets may have changed. In the example that I showed previously, that was of like the Director of Public Health, how their mindset had changed with regards to community building initiatives. You can see just how long it takes for activities and impacts to occur. I guess quite often, like from an evaluation standpoint, we're constrained to maybe, I don't know, 6 or 12 weeks as an evaluation timeframe. And actually what we've learned from the ripple effects mapping is that some things can happen really, really quickly, but lots of other things, given the complexity of the systems that we're working in, it can take much more time than that to start seeing activities and impacts occurring. From a content analysis perspective, just recognizing that certain people prioritize certain types of data and findings more than others, it also allows us to kind of just simply quantify sort of the number of organizations that might have been involved, the number of different agendas that might have been aligned with, such as say air quality, mental health, We could see how often physical activity or the initiative more broadly had been embedded within local strategies. So there's lots of kind of analysis and findings that we can draw out of this to appeal to different kinds of audiences. And if anybody wants to have a look at an example of sort of this written up, then you can just sort of, scan this QR code and that'll take you right to the report. Alternatively, there's a few papers that we've published around this as well. And so I'm just going to draw this to a close by showing the different ways in which REM has been maybe combined with, or we're thinking about combining REM with other methods and other techniques. So we've done quite a bit of work blending ripple effects mapping with systems mapping outputs. So what we're able to do through REM is identify a whole range of different actions that might be being implemented within a particular area or a particular program of work. And what we can then do is actually like overlay those actions onto a systems map to visually demonstrate where efforts are being placed in terms of changing how that system works. It's quite simple. It's certainly, it is a very simple kind of technique, and it does have sort of a number of caveats to it. But from a stakeholder perspective, it is very helpful for them to reflect upon where they've been placing their efforts to date, or where they might want to invest some energy going forward. We've also seen, working with some colleagues in Denmark, trying to bring the action scales model into this too. So using the action scales model as a bit of like an analytical framework to better understand like the kind of activities and impacts within the REM outputs. And just using this as, again, as another example, we can then also code those actions against the different levels of the action scales model. And then more recently working with colleagues from Leeds University, trying to, I guess, align ripple effects mapping with more of a realist evaluation approach. So that's kind of going into a lot more depth as to how and why actions might lead to specific kinds of impacts. And there's a paper there which is under review at the moment. But as and when that's published, I'll be able to share all of that. But that really digs into the how and why things are working and for which different kinds of population groups. So thank you all so much. Sorry we started a little bit late there, but just to conclude, we're really starting to see like a widespread adoption of systems approaches and systems thinking within a public health context, not just here in the UK, but elsewhere. The action scales model is a useful and pragmatic tool to support deeper understanding of a system. We're also seeing it being used as an evaluation tool as well and being used by academic audiences. And then ripple effects mapping being a really helpful method to try and capture some of those less tangible impacts that might be coming about because of a public health initiative or a policy. And I just want to reiterate that I think it works best when we really blend it with other methods too. So I'm going to stop there and hopefully then we've got time, Daniel, for any questions if there are any. And there's my contact details on the bottom there too, if anybody wants to get in touch afterwards.
Hey, thank you so much, James. That was an excellent session, so rich with information and knowledge. So thank you for presenting that. And yeah, of course, this session has been recorded and will be available on the SPHR YouTube for those who'd like to go back and refresh themselves. So we'll open up the floor to any questions if anyone has any. I can see one that's come through already from Evie. So question, can the ripple effects mapping be used during the design phase of an intervention, i.e. before the intervention has occurred, to, for example, inform a theory of change?
That's a brilliant question. It's one that I was running some training on ripple effects mapping on Friday, and it's one that I got asked there too. I think it will work better once an intervention or an initiative is being implemented. I think there are better tools available to support the design of interventions or to support the design of theories of change. But what you would be able to do is, if you're using ripple effects mapping, once an intervention is kind of moved more into that delivery or implementation phase, you can then use the findings from within the REM output to feed back into almost like the continuous development of a theory of change. Because we might anticipate that that project or program is going to work in certain ways and lead to certain outcomes or impacts. But actually what the REM might show is that there are tons of other things that it's leading to, and maybe consistently leading to, that we want to build into our theory of change as it moves forward. So I'd see REM as a method to continuously refine and maybe improve a program theory, as opposed to, to refine a theory of change, rather than a tool to actually design an intervention per se.
Okay, thank you. Question from me, just as we're still waiting for more questions to come through. So in your paper on ripple effects mapping, you mentioned that it seems to work better with projects that are more open-ended and highly adaptable, rather than being more prescriptive or prescriptively defined. And you've mentioned, of course, as the methods for systems thinking is evolving and developing. Please share your thoughts on how more rigid or various other styles or methods could be complemented by ripple effects mapping. I don't know if there's anything else you can say on that.
Yeah, no, again, I think the example that I showed on the very first slide is probably like kind of one of those more traditional, I don't know, historically so the cycle training, the cycle proficiency training, like historically we could maybe evaluate that through like a randomized controlled trial if we wanted to understand the direct impacts of, say, attending that kind of training. But I think even if you were to use like an RCT in that sort of context, having something like REM to run alongside of it would enable us to understand, like as I said, like the wider impacts of maybe what we traditionally consider to be quite a simple intervention. Lots of simple interventions lead to wider anticipated or unanticipated impacts, but they wouldn't necessarily have been captured through, I don't know, those more traditional RCT type designs. Even if we had a process evaluation in place, they might not necessarily be looking at capturing the wider impacts of those kind of simpler initiatives over time. So I think I'd see like REM as a tool that could certainly supplement any of the more traditional research designs that we've got, if we feel that those kind of interventions have the potential to have wider impacts. And I think whenever like people are involved, or whenever we're trying to like intervene within sort of social systems or complex systems, these types of interventions are going to work in ways in which we didn't always anticipate they would. So it might be a really useful tool to just run alongside, as I say, those more traditional methods that we are accustomed to.
Yes, for sure. And I think that's one of the benefits of systems thinking, its ability to complement multiple worldviews and also structures. So Connie, do you want to go ahead?
Thanks, Anna. Thanks, James. That was a great talk. Yeah, I really appreciate that you came to speak to us. I think it fits possibly quite nicely to what you've just said. I guess I was wondering, have you seen that REM was used to inspire then kind of more other methods to be used, kind of starting, say, you've seen this great development of a community group and what was happening through that you could then see, say, a qualitative study put on top of that then tries to really understand how community action has been started. So kind of almost like a starting point for more research, or maybe just a way of then feeling it would be great to kind of gather more evidence of what's going on there, because it seems really important and might really inform other bits of our intervention or the system. Yeah, if you've seen, you can see how that can go out of hand, I guess, finding lots of interesting things. But yeah.
That's, I suppose, just from a critique of the method perspective, like it's very much dependent on like who is attending those REM workshops and the knowledge they have about the impacts of a particular project or initiative. So the way in which, like, to your kind of point in your question, like the way in which we've seen it start to be, I haven't been involved in these evaluations, but I've been involved in the discussions around the design of them, is that people would use like the REM workshops to almost like open up some other avenues to explore via different research methods and means. And so they're considering like how they could use I don't know, surveys, for example, to try and capture the perspectives of those stakeholders who are perceived to have been influenced upon. Or they're using like the REM output as a way of snowball sampling so that they could go, for example, using, I don't know, semi-structured interviews, they could then go and speak to the people who've been identified in these REM outputs. So it's opening up like lots of other potential avenues for further research. And the other bit that I was just going to mention is like REM, like a limitation of it too, is that it can be like quite superficial. So you don't get into the depth of sort of like the why things are happening and how it's really working. So that's where the development more of like the realist ripple effects mapping should be very useful, because we can understand what's happening at that sort of superficial level, but then we can delve into it in much greater depth using some of those more like realist evaluation techniques. Yeah, so there's multiple ways in which it has been used and is being planned to be used in order to like answer additional research questions.
Sounds great, thank you.
Yeah, okay. Does anyone have any other questions or comments they'd like to ask? Otherwise, I think we could bring it to a close. So huge thanks again, James, for joining us and for your session. I personally found, especially the opening up for future research avenues that this work could potentially go, is to be very exciting. So thank you for that. And this is our last planned webinar in this series. So thanks, James, for being the person to sort of round us off. But thanks also to the speakers who have joined in our previous webinars. I'd like to say a massive thanks to all of you. Thanks also to the COAST team who have helped organize this series, who have helped to arrange our speakers to bring them all together. Thanks to the SBHR team, thanks to Amy and Andy, who have helped actually run these sessions on Zoom and get them out recorded and out onto YouTube. And thanks lastly to all of you, our guests who have joined us, who have tuned in and have asked questions. So we hope you have found the series useful. Again, the entire series is available recorded on YouTube. We'll be sending out a survey sometime soon. If you would like to feedback on how you found the series, how you found the webinars, and potential future opportunities for other webinars that you may be interested in. So look out for that survey. I'll send it out via email and along with the link for this recording. So thanks again to James for the session, and thanks to all of you for joining us.